Hello, everybody, and thank you for joining our webinar today. We are looking forward to this wonderful topic and our great speaker, Dr. Banks. We're going to go ahead and jump on in and get started. So I want to make sure that I introduce everybody. My name is Sheela. I am from Pearl. I am head of clinical education, by trade, a hygienist, and been working at Pearl for a few years. Hiding with me, but along for the ride is Kimberly. She's the director of growth in our practice for partners. In our at Pearl. And then also we have our wonderful partner, Tab 32, which we're really excited to share with everybody, the new native integration. So Warren is here as VP of Sales and Marketing. And without further ado, I will also introduce Dr. Banks. And excuse me, he is here with his office practice manager, Samantha. So we're very happy to have them here. It was very interesting to read all about Dr. Banks when we were first getting ready to meet. Lots of things you've done in dentistry over the past 30 years, especially working mainly in Northern Virginia, if I have that right, and joining the Blue Ridge Dental Group. You went to school at University of Louisville, which is wonderful, also got a master's, and lots of fun things about you, enjoying outdoor activities, camping and hiking. I love that you are enjoying cooking. I could use some of those recipes for sure. And we're really excited to have your expertise today. So we're going to jump in and thank you everybody for joining us on the call for the webinar, as well as again, our partners and Dr. Banks. So I am going to share my screen and we are going to dive right in here. All right. So today's webinar is really about mastering chairside excellence, confident case presentations that Dr. Banks is going to share some of his wonderful experiences with his patients, and also mentorship with technology. So a couple things we want to talk about today is really as we work together here on this webinar is what is AI, right? How did it get into dentistry? And how is Dr. Banks using this for assisting in diagnosis? How the native integration really is such an incredible way to remove any change management and working through calibrating, new associates. As hopefully Dr. Banks, you get to have more people take over for you and you can share your knowledge with them as well. We know that's really important for patient retention and really what's the future of AI. So we talk a little bit about, you hear the buzzword in AI now. I mean, in dentistry, in medicine, in driving down the road, everything's AI, right? I remember watching golf one day and there's a commercial about Tiger Woods AI, tool that we could figure out how to get a good golf swing. So it really is kind of a buzzword, but when we think about defining AI, it's basic. It's very basic. We talk about how we're really teaching a computer to do basic skills. I think it's important to understand that what most people think of AI is this scary take over the world, Terminator type of situation. And this is more of a general artificial intelligence, not something we have to worry so much about now. But when we think about radiological AI, we think about very simple tasks like caries recognition, right? And how billions of images have been put into a computer in order for that computer to also assist in understanding pathologies. So similar to, this computer was able to beat this chess player, but at the same time, couldn't really have this conversation with a patient about, dentistry or cross-referencing treatment plans and previous and all the things that dentists do in a day. So we really talk about where AI is heading, and it's really to complement the dentist, right? We see in AI in business, and whether it's dentistry or even the global impact of AI, is almost 3 out of 4 businesses are exploring or utilizing AI. And as we work through this webinar today, it would be great for you to kind of think about what simple things that AI can do in dentistry for you so you can spend more time with your patients, as well as how AI kind of snuck into our world, right? We didn't really get any notifications on our phones or anything else that AI was going to start taking over simple things like, for example, your facial recognition on your phone, right? That's a form of computer vision, a form of AI. Natural language processing, those of you using ChatGPT, or even predictive data analytics. We think about, it's nice that Bank of America tells us there could be a fraud on our account, but imagine a place where very soon we're going to be able to look at an x-ray from the past. We look at what's happening in the present, and then we can start thinking about how does that data help us make really informed calculations for predictive analytics? How fast is that decay going to progress, right? Past that DEJ, if you will. So I think we're starting to really embrace AI and be able to see, wow, how is this going to complement our lives and not necessarily something we have to fear too much. So in dentistry, we see all kinds of different ways that AI is coming in. Robots, aligners. I say robots, meaning like the implant placements. AI for automated perio charting. Some of you that have used AI with your appointments to eliminate some, possibly. There's a lot going on in artificial intelligence. When it really comes to dentistry, we need to be mindful of where are we heading and how is this going to complement us. Dr. Banks, you said something earlier today that was really interesting too, because you were talking about when we're diagnosing and when we're really looking at images, which we're going to get into in a moment, you were talking about how it's kind of this assistive tool that you've been using. So can you share a little bit with us about how you've kind of focused on working with AI and how it's been working just briefly with your patient, because we're going to make sure we hear from you as well as we move through today.
Well, I'm obviously going to date myself here. But just today I had a patient in hygiene and took our regular bite wing radiographs. And then we put it up on the screen. We have television screen in each room. And I was reminding him how, way back in the day, we took the little, small x-ray film and put it on a light box and pointed there and said, "See your cavity?" And they're like, "Yeah, nope." So then we got this big screen and I've got it up here. I said, "Do you see your cavity right there?" And nope. I said, "Well, we've got something new. We've got artificial intelligence that helps us show you your cavity." And so clicked on Pearl and I said, "Yeah, 3 cavities." So it really does kind of bring it home for the patient of, because before they couldn't see it and now they can.
Mm-hmm. Yeah, I think, yes.
That being said, I never fully trusted. Because I've seen some things like if you have a tooth that's rotated or something and you're going through a less dense area, the computer's still learning that not every radiolucent area is a cavity. And
yes.
so it's like I have it off and see what I can see. I turn it on and see what it shows me. And then I turn it off again and go, yeah, it is there.
That's the perfect workflow that you're describing, and we'll get into some cases today, but I love how you mentioned, what AI does for us as clinicians and this bifurcated approach that what AI does for patients, right? We all have gone into dentistry because we want to help our patients. And I remember as a hygienist walking by seeing I'd walk down the hall and I'd see a big x-ray on the screen and this huge, cavity or this need for a root canal. I'm just so sad. And as clinicians are walking down the operatories and looking at screens, we all can see these things in seconds. But the amount of time it takes to really kind of share that information with our patients and the patients to understand what we're talking about. That's what we want to do today, is kind of find a way to enhance that experience so the patients are accepting more of the dentistry that the doctors are recommending. And really kind of earlier, and more often. So as we dive into all the different places that we're seeing AI in dentistry, we talk a lot about change management, with scanners and workflow and all that kind of stuff. But really, when we're looking at radiological AI, Dr. Banks, your story is spot on. How many times a day are we really talking to both existing or new patients that come in with interproximal lesions, right? And to have it in color really takes that case presentation to the next level. So those pathologies that exist are periapical radiolucencies, notable margins, great for hygienists to kind of feel around in there before you get into that exam. And calculus is a great pathology indicator as well for the teams that are, trying to explain to a patient when they've never heard about calculus in dentistry. That's math, right? And also when we're talking about these case presentations for areas that patients are looking at black and white. And sometimes I remember thinking, the more I talk, the more they're going to understand. And that was actually completely incorrect. So having color in dentistry has really been a game changer. And you were saying dating yourself, but I remember dipping x-rays in those little processors, right? So we probably did that, right? So we look at dentistry and we look at, how did AI even get here, right? And the history of modern dentistry, we can see really kind of these technological advances that have pushed our industry forward and really also shaped kind of the business side of where dentistry is going. When we talk a little bit about radiological AI, I think it's important to know that this is happening live in real time. So you take images, you're able to have those up and ready for the doctor to come in and do those exams. We're looking at, case presentation here with areas that we think about, we struggle with as clinicians. I remember talking about which teeth we're going to fill versus which teeth we're going to watch, and why would I need a possible root canal, right? Like you were saying, Dr. Banks, do you see the cavity? And now they can see those areas, in color. And when we look at showing them their teeth with, white, they're used to that. They understand enamel. They look in the mirror and hopefully they're flossing and they see, I have white teeth. Why are there pink dots now in my x-ray in between them? So I think the days of us still presenting dentistry with x-rays is important, but now we have a new way to do that. Our industry is really kind of incredible when you think about how many x-rays we are responsible for on an annual basis and how we're really leapfrogging medicine when it comes to AI. There is another reason to be mindful of using AI. And I think, Dr. Banks, too, for you, I mean, you've been practicing for a very long time and trust is a big factor. That's a good thing. That's a badge of honor, right? We know how many massages and things you probably had to get to stay in dentistry that long. So with your expertise and you're seeing, trust is always an issue for patients, right? And sometimes it takes them a while to trust your diagnosis. And, we think about why do patients not accept dentistry? And as a profession, we still have an unfortunate clinical inconsistency in dentistry that our patients see. They go to another doctor. I had 5 cavities. I came to you. So what do you think about having this trust issue that still unfortunately remains in our profession? And do you think showing the AI images kind of helps infuse trust? Like, for example, those light pink lesions, right? Where you're not going to fill those areas. There's decay still in the enamel. How do you feel like AI is going to help infuse trust back into your case presentation?
Well, first I will say that I've had patients come in that went to another office and they told them they had 6, 7 cavities. And I'm like, nope, don't. And of course, that was before Pearl. Now those patients actually might have cavities, but I think being able, you're looking at every dentist when they do an exam, they're subjective. We try to be objective, but we're subjective. Okay. just like you were talking about, it's right at the borderline. Should we fill it or should we watch it? It's a subjective judgment. So now you have something that's more objective, something that is taking the image, it's evaluating it objectively, no judgment, and it's just saying, this is what's there. And so I think they're getting kind of that outside objective opinion, be it from a computer, that they're more likely to, if you're saying it and the artificial intelligence is agreeing with you, then you probably have more trustability, if you would.
Yeah, I think you're right there too, where patients have to understand like perceived value, right? And we see that when we look at an x-ray. But do they see that? And to your point, you bring up a great perspective with it being very objective. We won't spend a lot of time on this webinar today, but we could do a whole hour on diagnosis fatigue, right? Dentists, it's really quite incredible what dentists do throughout the day. Not only are you typically an owner, you're a manager, you're a diagnoser, you are doing the treatment. Like if you look at medicine, right? And I go in for my knee, I'm going to have someone, take the radiograph, then, or the MRI, then someone's going to read it. Then they're going to report it to the doctor. Then even possibly someone else may do the surgery. Who knows? But in dentistry, you're wearing all those hats, not to mention you've got crazy people like me running around. I need an exam, right? And so you are having to review radiographs very fast, very effectively. And we're humans, did we eat lunch? Did we sleep? Is there crazy bills coming through? And having the AI not needing to be worrying about, subjectivity is a huge addition to our space. I used to think about when I first started with Pearl, like spell check, right? Underlines these little areas for me to take a closer look at. And I think about that with AI. So when we look at numbers, there's a lot of data here, and these studies are on our website. They talk a lot about the inconsistency that is still creating that distrust. And the one in the middle, the study in the middle is very interesting to me because we had 3 clinicians do a review of 9,000 images, and they only agreed on if there's actually a cavity, not if you're going to fill it or not. And I think sometimes that's where people get stuck with AI. AI is going to point out pathologies. It's not going to treatment plan, right? That's what the doctor's going to do. And when these doctors looked at these 9,000 images, they agreed 4.3% of the time through 9,000 images that there's actually a cavity there. And that is, it makes sense to us as clinicians. We all can say, well, yeah, it's, where we were taught and what we see. And to your point, subjectivity, but also they looked at the same images 90 days later, and they only agreed with themselves 70% of the time, right? So it does really kind of show you why AI is really so well poised for the dental space. A lot of studies here about, believe it or not, people think, well, AI is going to diagnose more, right? And we're seeing here that it's really the exact opposite, where AI can possibly help assist in areas that might get otherwise missed, especially when we have such a, I don't know, I think of dentistry right now as being kind of the most intense times because we don't have as much staff, right? And we have so many more patients usually, and there's so much going on. So we want to kind of move into the trust side of things. In this ADA study they recently just posted this year, this is still the #1 reason patients stay with their dentist, right? And unfortunately, we still have about 40% of Americans that are not trusting the dentist. Now, I think those numbers hopefully are going to consistently improve as we become kind of more transparent. So we have no change management necessary, and we have an educational, objective, quantitative perspective on not only radiograph review, but also patient communication. Now, here I want to talk a little bit about using this with your team. So have your hygienists been using AI at all with talking about calculus, or have you been mainly using it yourself in the operatories? And what do you think about moving this into using this with associates and helping them kind of understand how, maybe you're looking at diagnosing, or maybe helping them, even if they're younger, feel more confident? What are your thoughts on your team using AI, and also how you're going to work with the new associate you have coming in?
How long do we have?
Oh, you got the whole time here. You go right ahead.
Well, I've been talking to the hygienists more about it. I mean, we have a couple of them that were fairly consistent in using it for like clinical attachment loss and help reinforce their charting numbers. Was talking to one today that we were looking through a patient's radiographs, and there's a block of calculus and it highlighted it, and then there's another box highlighted. We're both kind of squinting, but it was there, but it's something that would easily have been missed as far as calculus. Mm-hmm. And then I talked to the front office staff this morning about SRP claims being denied and things like that, and suggested that, next time you send that in, and send in the full mouth series, but then turn on Pearl and send it with Pearl marked. Mm-hmm. And that's kind of like the preemptive strike. I mean, if the insurance companies are going to use AI against us, we might as well show them that we've got something to fight back with. And I think that'll stop a lot of claim denials. Maybe not from United Healthcare, but sorry. After that claim that they were denying 30%, that AI was denying 30% of their claims automatically. So that was the only reason for that comment. And as far as a new associate, I mean, I'll give you two things on that. I think it will help them. I mean, they went to dental school, they took boards, I hope. And, so they have to be able to diagnose. I mean, first 2 years of dental school, well, all 4 years of dental school, you're diagnosing and treatment planning. So after a while, you've got to learn some things anyway. Then you get into practice and find out that you really didn't learn that much. But anyway, I think it'll help a lot, because even coming out of dental school when I did, you're constantly kind of second guessing yourself on things. Mm-hmm. The only problem with that, in dental school, you had time to second guess yourself. When you get into practice and you're chasing patients, you don't really have that much time to second guess yourself. And so this will speed up the second guessing and, help clarify what you want to do. At the same time, with a new associate, you kind of want to give them their independence, obviously, and let them come and ask you questions if they have questions. But at the same time, you don't just let somebody loose in the game yard and not occasionally look and make sure that everything's going well. So it'll probably save me some time on that end, being able to just kind of double check some treatment plans and make sure that, everything's going the way that it should.
Yep. I think that's a great way to think about that. There's so many ways that, we can use AI in general, but really it's hard right now to find really good associates and hygienists and assistants in front office. But really, when I was working in my last practice, it was interesting to hear how many associates were seeking clinical mentorship. And that's really a nice thing to see as they come out of dentistry, especially when they come out of school and they're thinking, I know they got to jump in and pay bills, but the ones that seem to really stick and last in the practices that I've worked in are the ones that were really thankful to work with doctors that, like yourself, Dr. Banks, that could help them understand, because they haven't opened so many teeth, right? So they look at an x-ray, they have to drill the tooth. It's just like with hygiene, we do scaling and root planing and we look back at the post-op x-ray and we're like, oh my gosh, to your point, there's more calculus still. So I do think that it's a great way to acquire and retain associates, but also, this probably more than anybody, is it's important for patient retention, right? That doctors, like if I come to your office and you do an exam on me and Dr. Samantha over here does an exam on me next time, and they can be different, but it shouldn't be like 3 fillings, like you were saying, versus no fillings. So making sure that we're all kind of on the same page historically has been a challenge in the dental space because it takes time to go through and find charts and examples. And with having AI, you can just, like you were saying earlier, turn it off, look at the image together, turn it on, and see, what areas that your team would like to move into. I think when you're looking from a clinical side, we could all do some quizzes here on how long it really takes us to review radiographs, but we don't get to stop and just review radiographs like somebody like a radiologist, right? Which would be nice. Just close the door and look at all your x-rays and then start, moving into your preps and your exams and everything else. It's really on the fly. And we move through x-rays much faster when they're highlighted, right? And again, is it perfect? No. Shades of gray in an x-ray, really by the AI, they're reading about 500 to 700 shades of gray, but the human eye is reading about 50 to 70 shades of gray. So again, some of you on our lunch hour, so we won't keep you too long here, but if we were to do some quizzes on how many areas of decay and took a poll on this call, we probably wouldn't all agree. And remember, when you're looking at this image, we're not talking about the AI finding areas you're going to treat. We're talking about areas of pathology, pointing out areas of interest, right? Like back to spell check. Some of those things, the spell check doesn't know the right word either, so I disagree. And it's going to be very similar to how you're looking at images. Same thing for the hygienist, right? And again, thinking about my hygienists do a great job, but the patients don't see the calculus, right? So we're really discussing no workflow change, just taking that treatment presentation from night, black and white images, today, lots of color, right? So we talked a little bit about how you see AI kind of helping with case acceptance. Walking into an x-ray like this makes a lot more sense for a patient, especially when we're talking about bone level measurements. You were saying sending those in as an additional source of documentation to decrease denials with scaling and root planing. And really, this was a perfect example that I'm sure we could all relate to on this call. One of my best friends, her daughter went away to college and was seeing a pediatric dentist forever. Finally, after college, her mom decided I'm going to take her to a regular dentist. I'm like, okay, Cherie, it's been like 20 years. It's a good time. But she's like, yeah, she's coming in. She doesn't have any cavities, but she just wants to get her teeth clean. So she took her to my old office. And she called me and she said, what? Right. She's like, what is wrong with your office? She has like 9 cavities. And I said, what is wrong with your daughter? No, I'm just kidding. But really, this is really when we look back at how many patients you're seeing in your day that you're discussing interproximal lesions or periapical lesions or calculus, and are the patients understanding what we're just talking about, right? And we want to make sure that this poor patient, Kendall, doesn't have the same cavities a year later, right? So we need to figure out what exactly happened here. So case presentation is really important, and those printouts are helpful. I'm not sure, Samantha, if you've used those yet, but even being able to send them directly to your patients for when they walk out the door, sometimes we print them out, or also when we think about moving into those SRP issues. Again, case presentations where we've seen just AI being able to move through images really fast, and again, calibrating those associates, right? And looking at, wow, what does it look like when we open that tooth? Really, the bottom line here is case acceptance. Pearl's not meant to have a doctor go in and diagnose more dentistry. That is not the goal, right? In fact, we know that case presentation acceptance rates kind of drop off as the case presentation numbers increase. But what we all want is patients to accept more dentistry. And I think that's the value here. So we talked about Pearl for quite a while, and now I'm really excited to step into the native integration with tab 32. Again, myself working in a space where the last practice I had, I managed 22 hygienists. We saw 2,000 patients a month in hygiene. One extra step into Pearl is very simple for them, but they didn't have the luxury also of working with tab 32, where there's a native integration. And what that means is inside of the imaging system, the AI is already present. So they wouldn't have to go. I know a click of a button is not a really terrible, traumatic thing to do in dentistry, but every click saves time, right? So I'm going to stop sharing my screen and pull up kind of the magic of today's entire visit here, talking about how the native integration works. But I want to talk to you, just Dr. Banks, tell us a little bit about your experience with having AI directly into your standard imaging system. And how is that going for you in practice?
When we first had the presentation on Pearl, that was, Sam and I were there, and that was kind of like the big question that we're sitting in the back, mumbling back and forth to each other of, okay, we're going to go and have to look at these images and look at Pearl, and then we're going to have to go back into tab 32 and input the treatment, and then go back to the images and back and forth like that. And how long is that going to take? Mm-hmm. And so, honestly, if it were that way, I don't think we'd have Pearl. But as soon as we found out about the native integration, it was like, oh, okay, now it's not going to cost us more time. It's going to save us time. And I just have to say this one thing. If there's a dentist out there or a hygienist out there on virtually any operating system, x-ray system, if they think they're not already using AI, then they're wrong, especially if they're enhancing their x-rays. So anytime you hit that enhancement, that is a form of artificial intelligence. It's filling in pixels in that radiographic image. And it's has a programmed way of doing that. So that's AI. You're already using it. So why not use it in color?
I love that. Yes, I couldn't agree more. And having the ability to, the cumbersome extra click is there. But what we found in the standalone product is the nice thing is you're buying back so much time where you don't have to worry so much about discussing dentistry in black and white. And that time that you get back allows your patients to ask those questions, right? Which is, why do I need this? And do I need to worry about this cavity and that cavity? Now, if you could just nod your head that you guys are seeing my tab 32 screen, because I've had to switch over for a minute. Are you seeing that? You're not. Okay. So let me share that. I want to make sure that you're seeing. My magic trick isn't working very quickly here. So hold on. I did just go to the Magic Castle recently down in Hollywood, but I didn't pick up any skills, obviously. So let me just grab this. Okay.
Sam just lit up. Did you see that?
Oh, Sam. Did you want to go to the Magic Castle?
I am the princess, but I'm pretty sure that I'm the princess before we meet the prince, even though I'm happily married. I'm the cleaning princess.
Love it.
She visits Disney more than once a year.
I love it. I love it. Okay. So you are seeing tab 32 now, right?
Yes.
Okay. So what I kind of want to just lean into as you look at this quick little demo is really, to me, especially training teams and hygienists and doctors, is there's really no change management. You just open it up and you can click off and on. I think the important things to know is this is where you will view your imaging system. And you can turn the AI off and look at your regular images, and then you turn the AI on. This colorful tooth part section here is really when you move this into the operatory, right? One doctor I worked with when I first showed him this, he's like, Sheela, I don't need the cartoon teeth. How do I turn that off? And I was laughing. I'm like, okay, well, your patients need the cartoon teeth. But it was really kind of a funny idea, right? Because clinicians don't need this view. But really, we talk a lot today about what are our patients thinking and how are we able to really get them over the line? And also the wonderful experience of cutting down on the amount of time it takes for radiograph review. So as we kind of move into finishing up this webinar, I just want to make sure that the team understands that this is in real time inside of your own imaging system, and there's no change in workflow. In fact, you have this nice little legend here on the right-hand side, but after any clinician looks at one image, there's no need to worry about any manuals or training because it's very easy to follow. So it's exciting to have the benefit here of bringing kind of two worlds together. And that's what we're really thankful for with our partnership with Tab 32. So I just kind of wanted to stop here for another couple minutes and see if there's been any questions for anybody on the call. And also talk just a couple minutes about anything, Samantha, you wanted to add. Have you been able to maybe share images with patients on the way out, or have you been working on sending those images in with claims?
Yeah, so we've used it a lot in our appeals process. Because, they'll be like, well, our AI says, and we're like, well, our AI says. And so we'll send it around with that. The biggest thing for us, when they finally get out of the operatory to the front desk, they have all of this stuff that they're processing in our head, and it allows us to kind of get down on their level and use tribal language to say, if this pink stuff is in the purple stuff, that ain't good. It allows us to keep it really simple for them. So not only do they trust the hygienist, they see them more than the doctor most of the time. But then they trust the doctor, and then we are the icing on the cake whenever we are going over their treatment planning to say, you really should look into this. The percentage that it's in your enamel, the percentage that it's in your dentin, like we can kind of get them to understand the different layers of their tooth better. And it just helps with the case acceptance that way.
That's exactly what we're all looking for, right? Loving to have patients accept the dentistry, and really before the patients walk out the door, right? We don't want to have to call them back later. And there is that funny dental amnesia that they walk from the back to the front and it's like, oh, doctor said I was good, right? And we're like, no, we heard what the doctor said.
How many times have I overheard that?
Right? And then we run back and we're like, Dr. Banks, can you come to the front really quick? Because Mario here doesn't believe you. So I'm just kidding. But it is really interesting when the clinicians present everything. We feel like we're talking till we're purple, and they do need that extra step for the front to be able to say, yeah, okay, so doctor said we're going to move into these two fillings. And also, if they don't accept the dentistry, I know that I used to print out, these treatment plans, and they take it home, and this 2-surf MO comp weird thing, and we'd expect them to call back when they're home reviewing that. But having that printout on top of it is also nice to see. I think, oh yeah, go ahead.
Yeah, and we are about to come up on our 6-month plus of having Pearl AI. So it's really going to allow us, now that we have historical film along with this, to be able to say, hey, you didn't accept this treatment. We treatment planned 2 surface filling on tooth number 8. Now you're going to need a crown. So
Right.
now they're seeing it in color of, oh, the doctor was right. If I don't get this done, it is going to cost me more. So we are excited about having the historical film to be able to kind of give them that time lapse of, all right, the last 6 months that we saw you, here it was. So we are excited about that portion of it. But also I know Dr. Banks and I, like we sat in Patterson's presentation of Pearl AI, and we're like, gosh, it's only like if we missed one filling in a month, like the cost would be, with having this would pay for itself. And then again, they were like, we're not integrating with tab 32. And as soon as it popped up on our computer, we were the first to be like, hey, tab 32, we want it. So we really enjoyed it. There's sometimes, like Dr. Banks said, like, obviously he went to school, he knows how to diagnose more than a computer. But that's the judgment call. And it's,
Right.
what are you going to do with the information that they are allowing you to have?
Excellent. I love that. It's just love hearing from you guys, because it really kind of paints the picture that we all the challenges that we're facing on a daily basis, right? Which is just the patients understand what we need them to accept, and let's get it scheduled, right? So it's been really helpful to hear how you guys are using AI, and also really kind of level set on what the expectation of AI is as we move forward into the future. Pearl does have a standalone calibrate tool. Again, you can kind of pop x-rays in there. You can pick and choose what you would actually diagnose as an owner doctor or a senior doctor. And then you can actually send out emails to test associate doctors and stuff. Also, moving through the staffing shortage, we think about how are we gonna, I'm sure, Samantha, you would love, sorry, Dr. Banks, I'm gonna put you on the spot, another person to help you with your regular tasks. But what if we could have kind of a virtual staff member? And in Practice Intelligence, Pearl's second feature, we do have the ability for people to verify insurance, look through all the patient's charts, tell you, which patients are due for x-rays, and then also putting in kind of an automated patient roadmap for your entire team to follow for increasing same-day dentistry, or even decreasing cancellations, right? So I think the important thing is for us on this call to really think about embracing AI in a time where we can all use a second set of hands, a second opinion, to help ourselves and also to help our patients. So again, I think the important part is the take-home message is, especially in our FDA studies, you can see that Pearl plus the AI yielded kind of the superhuman experience, which is 37% more disease detected. That doesn't mean it was detected for treatment. It was for you to be mindful of those lighter shades of gray and the pathologies that are there. And you're seeing in a lot of the articles about AI in dentistry is it's always going to say that there's room for improvement. And I think that's expected. What we should be thinking of, is there room for improvement in our practice? Should we think about using AI so that we are better together? I want to make sure that there is some time for those of you that are still on the call. And again, most people are probably trying to finish up before their lunch hour or their next patients. Are there any questions that anybody may have for the Pearl team, the Tab 32 team, Dr. Banks, or Samantha?
And breaking up.
Oh,
I think Sheila might be breaking up a little bit, but I can
Yes.
step in and say that she was just wondering, are there any questions for the Pearl team or the Tab 32 team or Dr. Banks or Samantha? We're happy to have some time to entertain those before you head back to lunch there. There's always a question about, how the value or how the quality of the radiographs that are coming in, how does, like, what if there's elongation? What if there's whitewash? Dr. Banks and Samantha, what have you seen with regard to the kind of instant feedback actually on not only the radiographs that you're taking, but how Pearl deals with that?
If there's, I'll go, we'll say elongation first.
Perfect.
If you have a little bit of elongation, which, indicates that you're not at a square angle, so it's not a bite wing, it's a periapical, let's say. Then what I've seen most often is that Pearl will actually misidentify the fossa of a tooth, especially a premolar, that it's going through that thinner part of the lingual or buccal wall, but not both. And it'll show that as a radiolucency and possible cavity when it's not. So again, you get back to your basic skills, but that's that and a rotation of a maxillary lateral incisor. Then you're going kind of through that thinner area of the tooth at an angle, and it'll show that up as radiolucencies. So again, it's artificial intelligence, but you probably need to rely on your human intelligence some too.
No, absolutely. That's what we've seen with teams. Sheila, I think your internet's back, so I can let you take over. But that's one thing that I've heard from teams saying that even the support teams, the hygienists, the assistants, they almost have more attention to the radiographs now because there's AI. And so they're very quickly to be like, ooh, something looks right. Those detections seem really strange. It must be elongation. Let me retake it. Or, oh, I have a little too much overlap. Let me retake it. But Sheila, I'll take back over because it looks like you're back with us. So thanks for letting me jump in. I couldn't resist.
But you're right.
Yeah.
I mean,
Yeah.
we do tend to pay closer attention to it because it's pointed out. It's like, I'll go back and take a second look. Did I miss something?
Right. And especially if there's overlap in your films, like it's a great coaching moment for the admin team and then also the clinical team to be like, hey, that's a non-diagnostic film. Like if Pearl can't diagnose it, we can't diagnose it. So it allows us to have those coaching moments where we may have missed it or the day gets so busy that we don't have that second eyes to show us. So that's what we're thankful for sure.
Awesome. I was actually just getting coffee. It wasn't the internet. No, I'm just totally kidding.
I knew
it. Well, I want to just kind of leave you with a couple key points here. And then also, again, if anybody has any questions, I'm not sure if anybody else wanted to add to what we have discussed here. I think it's interesting to think about where dentistry is going with AI. And again, providing just a little bit more data for us to be able to think about making the very best decisions. Imagine a world where you can have these conversations with hygienists. With the hygienists having this conversation with their patients, and imagine the same thing of it moving through caries, like into the next part of the tooth, like Samantha was saying, assisting in treatment planning, right? Not telling you what to treatment plan, but once you decide, let it do the work for you and pop it into the chart. It's going to be nice to see where the diagnostic side of AI continues to go, and also how it will help, again, with instant claim adjudication, and most importantly, oral systemic, concerns that we want to focus on. If those of you that are interested in looking into AI, this is a great code you can go ahead and scan, but we do want to make sure that, to Kimberly's point, if there's any other questions, I just want to make sure that you guys know we're here for you. You can always reach out to any of us, and want to also thank you for joining this webinar. Thank you to Dr. Banks for sharing your wonderful insights and your time with us, and Samantha, thank you as well. I think we might have a question here. No? Oh, perfect. So Kimberly's putting some stuff in the Q&A. Any other questions or last minute thoughts for us? Dr. Banks, do you want to wrap us up?
No, because of the two being integrated together, it just makes things so much easier and so much faster. And like I said, I used to show people films on a light box and say, see the cavity? And nobody ever could. So now they can.
And it also builds that bridge between admin and clinical. There's so many times, Dr. Banks, we have our office right beside each other, so we're always yelling Sam and Bob all day long. But to be able for him to come to me and like say, all right, look at this x-ray. And then I'm looking at him like, okay. And then he's like, okay, put on Pearl AI. I'm like, oh, all right. So I do it. And he's like, all right, take it off. Now do you see it? I was like, yeah. So it's allowing the admin team to know what we're looking at too when it comes to x-rays. So it's definitely building that bridge and marrying the two worlds together very nicely.
Excellent. We love your insight. We're really thankful to have your team on today. And again, just sharing those patient experiences and those challenges that we're all trying to overcome in dentistry. So we can't thank you enough for spending your time with us. We look forward to Dr. Banks inviting you back on for some more interviews, and Samantha, you too. So thank you again, everybody, for joining. Feel free to also reach out to Tab 32 or Pearl directly if you have some questions and some interest, and get started with your AI today for yourself and your patients. Have a great day, everyone.
Thanks for having us.
Thank you.
Take care. Bye-bye.
Bye.